few months brings mental health care in San Mateo County to the forefront of modern, patient-centered, and compassionate practices. I want to thank Governor Newsom and the state for their contribution to this incredible facility, along with our Board of Supervisors, and we've got Supervisor Mueller and Supervisor Corza here with us today, and also Don Horsley, who's not with us anymore, is deceased, but this was really his dream. The new building and the programs replace a 65-year-old facility originally designed as a hospital for TB patients. It has long past outlived its ability to deliver the kind of care that we in San Mateo County know is possible and that our residents deserve. And anyone who knows me knows that I like to say that even though our Board of Supervisors committed $1 billion to vital client-facing infrastructure projects in this county, we never have been and we never will be about the brick and mortar. It is about people, our clients, and serving them in a dignified and respectful way, and this is what we will be doing in these buildings. And to that end, I want to thank Dr. Africa and Louise Rogers, the Chief of Health, and the entire BHRS staff and all those in the medical field that have spent their professional careers helping those suffering from mental health issues and addiction issues. And this, ladies and gentlemen, is why Prop 1 is so important, because Prop 1 encourages counties to be ambitious about behavioral health care services and to address the root causes of the many challenges our communities face. And now we can dream bigger because of this. To supplement our clinical programs, we've extended intensive case management to help clients stay connected to services, and we promote medication-assisted treatment for substance use disorders, especially in our correctional facilities. We offer a highly effective peer support along with employment services and housing. And housing is key, as we all know. And we know solutions can be more comprehensive when programs work together. We serve clients at different stages, meeting them where they are at in the community. Our clients' needs are complex, and it takes many dedicated partners, including the state of California, to address their needs. And the state has been there for us. By working together, we can create innovative solutions and programming. And now let me say a little bit about Care Court. With Care Court, we have another tool to help get folks engaged with services. It creates an alternative option outside the petition process for families, health providers, and law enforcement. We have brought assisted outpatient services into the Care Court framework to make sure that clients have the support they need close at hand. Building and managing these programs are an opportunity for local government to express their finest values, caring for the most vulnerable, supporting those on the recovery journey, and promoting dignity at every turn. And Governor, this is something that you've done very well, and that is supporting our most vulnerable. And this is what the families want for their loved ones, and this is what San Mateo County wants for those that are suffering from mental health issues. So I challenged our team to be an early implementer of Care Court to get the governor's program up and running. And not a surprise at all, they were able to meet that challenge. So as of July 1st, 2024, Care Court will be open and running in San Mateo County. So I want to thank the governor for this program, certainly the Board of Supervisors, along with our courts and all our partners who have achieved this goal. And to the families of those with mental health issues, I want you to know help is on the way. Look, none of us here created these seemingly intractable societal issues, and it'd be easy to look the other way and kick the can down the road, but that's not who we are as a county, and that's not who this governor is. Governor, you've been bold in giving us the tools like Care Court, Prop 1, Home Keep funding, the encampment funding we just received, and SB 43 on the way here. And anyone who doubts how effective these are, spend a day with me. Come out to our encampments. Come out to the hotels we purchased, the navigation center that we have up and running. See the health programs we have up and the addiction programs we have in place, and talk to some of the 600 people that we've been able to place because of the funds that we have received from the state. So, Governor, I'm accountable to you. I'm accountable to this board, and I want you to know that we're going to meet that challenge. And I just want to encourage you to never give up, never give in. I know you won't. Keep giving us the tools, keep being bold, because San Mateo County stands with you, and we will get the job done here in San Mateo County. So with that, I'm going to turn the podium over to Lee, who I believe has a pretty incredible story to tell. Lee.
I have a family member, an adult child who's lived here at Cordilleras, initially off and on, and tried various placements. We moved to this county to get better services for him. I wish every county had available for mentally ill clients what this county has available. And my son just briefly became ill in his senior year. He was going to an academic school, Lowell, in San Francisco, when he started believing people could read his thoughts, look through his eyes, and hearing voices. He was immediately treated. He has been on appropriate medications for many, many years. When he was at home, I had pill boxes morning and evening. And when he's been in a facility like this, he's also been medicated. But my point is, it's not just medication. It's housing. It's housing and medication. John, I'm sorry, I didn't want to say that, my son, I am keeping confidential about him because there's so much mistaken ideas and prejudices about severe mental illness. But he prefers to be safe, and to him that represents freedom. So the third floor at Cordilleras has been perfect for him. It's locked, and that's what he wants. And that is the safety and protection that many mentally ill, severely mentally ill clients need. He tells me he wants the building locked so nobody can come in off the street and beat him up. So that gives him security, safety, and it's important that we have this whole range of placements. The county has tried different placements for my son. They don't work out, even the best of them. And when they don't, he leaves. He's a runner, what's called a runner in this mental health parlance. And he just walks out. Several times he walked up 101. He walked up 280. He'd head for the beach. He'd head for where he went to college. Sometimes my doorstep. And of course, when I learned he had gotten out on one of these times, I was always afraid. Would he be hit by a truck on the highway? Would I not be able to find him? So this has worked for him. And I'm very hopeful about the new building and that it will work too. Thank you so much.
Thanks, Lee. Wonderful. Thank you.
Oh, I am supposed to introduce Dr. Mark Galley. There you are.
Good afternoon. Lee, let me just first thank you for your just sharing a little bit of your life, your son's life with us. It takes a lot of courage, but because of your willingness to be up here with us, I think we start to really unpack and unravel some of those barriers, some of those challenges that you talked about. And I'm just very grateful for you and that your son is here and I think thriving. It is a real pleasure to be here today. It's exciting to think about the years of work, Governor, that you have put forward with bold new ideas, sometimes hard to tell exactly how it all fits together because it's a complicated soup of funding and rules and regulations and long lead times to buildings. But you behind me and what I just had a chance to tour is amazing. I mean, the setting, outdoors, nature, the buildings humane with lots of great space and color and open. And as you said, Lee, it works for people. And that's what's exciting in a world where for years we've dealt with stigma, we've dealt with the conversation about involuntary and locked versus unlocked and community-based. and that promise that was never delivered on, to create a full community continuum where people can find options that work for them as their symptoms, as their challenges, as their needs change. What I see behind me, because of many of the things, Governor, you've advanced over the last many years and helped put together, punctuated by the passage of Prop 1 and the flexibilities that those dollars will now have, the focus on housing, the focus on meeting the intensive needs of people with serious challenges, both in the mental health and the substance abuse and use range. I think it's exciting to see this place that shows promise. And Lee, you brought up you wish other places had this, other counties. Well, Governor, I think you've provided the tools, the funding, the opportunities, whether it's through Care Court or other options and Prop 1, to build exactly this. I've seen things similar to it in other parts of the state, and I think with the bond funding coming forward very soon, that we'll have more opportunities to see this. And I think the state continues to be ready to partner with counties. Like, I really appreciate San Mateo stepping in and stepping up, thinking about this as a partnership, seeing the tools and that word of accountability. Not that anyone's accountable to the state or the state accountable to the counties, but we are accountable to the people who today suffer, sometimes in on our streets, sometimes in our jails and prisons, sometimes in our hospitals, in our emergency rooms, often alone without someone by their side. And today is another example of how the state and counties, our local partners in partnership, are doing something different, something bold, and reimagining what our behavioral health system looks like in California, and really creating a behavioral health system for all Californians. So it is with that in mind, and a real privilege to have a small hand in helping us get to this day. I want to introduce somebody else who has really played a key role even before you came to this state, Secretary Moss, in really pushing for those housing solutions for individuals who have serious behavioral health challenges, the identification of what those settings look like, and not just where can we put them up and build them and keep them, but how do we continue to pay for them and support them. So your brilliance and leadership is much needed at the state. I'm really proud to call you a colleague. So without further ado, Secretary Tamika Moss.
Thank you, Dr. Galley. Good afternoon, everyone. As I was having a tour and listening to you, Lee, it just reminds me that everyone deserves a safe, affordable place to call home. And by accelerating this first round of funding that's made available through Proposition 1, the governor has demonstrated his sense of urgency and necessity to address our homelessness and housing crisis across the state. We all know how critical it is for people to have access to behavioral health services and housing when exiting homelessness. In my view, housing is health and health is housing. These are two sides of the same coin. That's why I'm so excited to work with my colleagues at Cal HHS, Cal Vet, to ensure an integrated approach to administering Prop 1. If we're going to address the complexities of our homelessness crisis, which often includes behavioral health needs, we must take a holistic approach. This behavioral health bond includes funding for community-level investments in treatment facilities like this amazing project here under the leadership of county leaders that I deeply admire, that will be administered by the Department of Healthcare Services, $2 billion of investments that will be administered by our Department of Housing and Community Development in collaboration with CalVet, $1 billion of which to create housing for veterans, and another $1 billion for others who are exiting homelessness. Proposition 1 also includes critical ongoing support to make sure that people stay housed. This is why we are asking counties to pair their 30% set-asides to housing supports that can be attached to housing units through their bond funds. This supports our entire community. We also think there's an opportunity for the full service partnerships, these clinically enhanced field-based teams that can provide supportive services to people on the streets through interim housing and supportive housing. These ongoing services are critical to our ability to provide the continuum of housing and services that folks so desperately need. This is exactly the right approach, Governor. I said so. And as Secretary of the Business Consumer Services and Housing Agency, y'all, I can tell you what solutions work to end and prevent homelessness. And this right here is one of them. Our Housing First approach provides housing and services to help people stabilize and thrive. We don't want communities to have to choose one or the other. It also takes an all-government approach, and from the leadership of my boss, the close coordination of our county and city leaders, our private and nonprofit partners who do this work every day, this is how we're going to make Proposition 1 meet the needs of the community and Californians who need it the most. So again, thank you, Governor, for accelerating this first round of funding. This is a game changer. I'm excited to roll up my sleeves with my colleagues. And now it's my deep honor to introduce Senator Becker.
Thank you. Some of my constituents have gotten tired of the homelessness crisis. They've said to me, Josh, I have compassion fatigue. And it's understandable in some sense because we've been trying to solve this for a long time. But what I've seen recently is increasing judgment, I would say, of our homeless population. And I think if we all search our hearts, we will find, I believe, that we know this could happen to any one of us that has a mental health issue. It could happen to our children or to a loved one. And I think we'd want to know that there are people out there who care, who are working on this, who are coming up with innovative solutions. And that's why it's so important that the governor is here today in our district, in our 13th Senate District, in San Mateo County, talking about solutions, talking about what we're doing to solve the problem. And it's not just Prop 1. This is part of a comprehensive strategy. Yes, we know we have to help our residents who have severe mental illness, 25 to 40% estimates of the homeless population. And we're doing it through Care Court, as you heard, through Prop 1, through SB 43, which hopefully we'll hear more about in a moment. And this is part of our homelessness strategy to build more permanent housing. We'll have a $20 billion bond here in the Bay Area on affordable housing, and as chair of the Bay Area Caucus, we'll be all in on that. And interim housing, that missing rung in the ladder between unsheltered homelessness and permanent housing. And a bill that just passed unanimously through the Senate yesterday on that. And so that is part of our comprehensive solution. And here in San Mateo County, where you heard from our county manager, we have a goal of functional zero. And that's the other part of this. We all have to believe that we can solve unsheltered homelessness. In California, 67% of our homeless residents are unsheltered. That's a lot more than the rest of the country. So we have to believe that we can solve this. And I believe this. Whenever I talk to Dr. Ghali, I believe it. And when I talk to the governor, I believe it because it's part of putting that together. And we know that any kind of transformation, and we're talking today about transforming our mental health system, any kind of transformation, it takes collaboration and compassion. Gandhi said that the measure of society is how we treat the most vulnerable. And there's no better leader in our state Senate who epitomizes that compassion and decisive action is our former social worker and former military. She's been leading us in this quest, and a great pleasure to introduce Susan Eggman.
Thank you, Josh. Good afternoon, everybody. I am so happy to be here today. My first job off the farm that I actually got paid for was in a locked psychiatric setting. And I think through my career, I have worked at every level of care and have seen up close the failures of our system. When we called ourselves rehabbing it way back 60 years ago, we really began, I think, a problem that has materialized before in our living history. We've seen it happen. And so it's taken a team and a governor like this to be able to say enough is enough. And I am so grateful I was able to be in a position to be there at this time when these things were going down. I have plugged away at these things for the last 12 years. Sometimes if I was all alone, but when the governor won election and said, we're going to do something about this, I knew that the tide was turning. So it's not just this one thing. It's not just Prop 1. It's every change we've made to develop an entire continuum of care. That when you present with an issue, it can be treated appropriately at that level of care. If you need more, you can move up. If you need down, you can move down. So there's a full spectrum for people. And we've done that through different kind of outreach, not having 911 come. We have 2 apps for kids anywhere, anytime. They can get support if they need it. We've built everything out. Some of the last things we're doing is some of the bigger policy, right? For so long, we were unable to really get out and help those that needed help the most. And they were the hardest to serve. They were the hardest to serve, right? It's not like we were making up these people that we were going to ship in from somewhere else. We saw them in our corners. We saw them in our embankments. We saw them disintegrating before our eyes. Like a wise doctor said, people were dying with their rights on. And for so long, it was impossible to change to a system that sometimes could hold people. We wouldn't let somebody with a severed leg lay in the middle of the street and say, I don't need any help, I'm fine. We wouldn't do that. And we talk about the parity between mental health, behavioral health, substance abuse, and physical health, then we have to really see that all is a continuum, and we have to provide the resources. So through Care Court, our real first step in bringing people in, bringing all the systems together, and thank you for this county for implementing. Everybody else will continue to do it the next 2 years. And then last year we were able to pass SB 43, which changed for the first time in 60 years what it means to be gravely disabled in California. To be able to expand it, to be able to take care of your medical care and your own personal safety, right? If you're in the middle of the street, but you still say you can find a meal that night, that is not enough to continue to be out in the middle of the street spinning around. And we all see that pain, right? You get compassion fatigue, but we all see that pain and wish there was something we could do. Well, this governor did more than wish he could do something he could do. Because then this last year, we're like, how are we going to continue paying for all that? So we need to redo Prop 63, right? When we passed that 20 years ago, over 20% of our population was uninsured. We look at that today, it's under 5. So the things that were once used as county funding for can now be billed, can now bring in more. So we can take that county funding and really focus on that wraparound care for those who need it the most, our most vulnerable, who live in our communities, in our bushes, in our embankments, in somebody's backyard. It's time to bring everybody out. It's time to treat everybody with the dignity and the care that they and their families deserve. I can tell you a lot of times we had advocates on the other side saying, no, voluntary care is best. Of course, nobody's arguing with that. Voluntary care is always best. But sometimes we need a little bit more, and we need more resources to do that. So being able to redirect this money, and as a United States military veteran, to have $1 billion set aside for veterans, we know in the last 20 years, our country has been in continual conflict, armed conflict around the world. All those folks are coming back, and they need our support and our services. So I love historical fiction. I love California. It is my home state. And I love that book, You Need Men to Match Your Mountains, or You Need People to Match Your Mountains, I'm going to say. And I think we have that in Gavin Newsom. Truly somebody has come on in partnership and said, we're going to get this done. Don't say no, let's say how. And so it's been my honor to partner with him and Dr. Galley and the whole team to be able to bring the changes to California that we need. But now San Mateo is on the leading edge of implementing, right? We can have all the policies. Now comes the implementation. That's our next path. And I, again, want to thank you all very much and introduce the man of the hour, Governor Gavin Newsom.
Thank you. Someone was recording that. Thank you, Senator. Let me brag on everybody in no particular order in a moment, but just want to express appreciation and gratitude that everybody took the time to be here, and appreciation and gratitude for all of the hard work that those assembled have put into this announcement, and all the hard work that was aided because of remarkable support from the people of the state of California, and I'm mindful of that. 40 million strong. They've given us tremendous support over the last number of years to transform our approach to address the issue of homelessness, address the issue of housing, address the issue of behavioral health, mental health, and substance abuse. They've also given us latitude to recognize that we need to do better and do more, and we need to all be held to a higher level of accountability. I've never been more enthusiastic about our prospects to actually make a dent and address the issue of what's happening on the streets and sidewalks in this state than I am today. These next 2 to 3 years will be transformational. We're at a hinge moment. We've addressed a lot of the barriers, a lot of the issues that we have struggled with for decades in the state of California, the inability to do certain things. We've met the moment, as Dr. Galley said, and we have achieved tremendous reform. Those reforms have been aided and abetted by Senator Eggman, Senator Becker, and others to address a myriad of issues. And as the senator was just saying, there are a myriad of issues that create a constellation that connect different component parts to address the totality of this challenge. Not one reform alone will achieve the results that people demand and we all expect. It's totality of what's been done in the last number of years that we will be accelerating and advancing with the announcement today that I believe will mark a new moment and new energy as it relates to these issues. Let me just briefly, very briefly, mark a particular moment of consideration. 5 years ago, there was no homeless strategies, no homeless plans, period, full stop. The state of California was not involved in these issues. Not 50 years ago, not 20 years ago, not a decade ago. Just 5 years ago, no homeless strategies, no homeless plans. To be fair, there was a $500 million appropriation that went to the cities and counties with no accountability, no oversight, and no measured results. That was the first time the state put in a few bucks. We had a Mental Health Services Act. I'll talk more about that. But it outlived the world we're living in. That Mental Health Services Act was passed 20 years ago for a world that no longer exists. We were listless, and it was pretty self-evident. The cities and counties were overwhelmed by what was happening on the streets and sidewalks, and we pledged a new paradigm, a new approach. We said we need to do more as a state. The cities and counties cannot do this alone. Cities and counties came to us, said it's about money, sure, but it's about more than just money. It's about resourcefulness. It's about doing things that we're precluded from doing, helping people that need help that can't help themselves. They demanded fundamental reforms. One of the most fundamental of those reforms was just advanced because of Senator Eggman. That's conservatorship reforms, issues around substance use disorder, issues around being able to get adequate medical care. Those were not considered as it relates to gravely disabled under the current construct of conservatorship. For decades and decades, governors and legislature have been talking about that and advocates have been talking about that, but nothing was done. We finally got that done. Now, here's what I want to communicate on that. Not every county is implementing it. The counties now have the tool under conservatorship reform, but the vast majority of counties refuse to implement it, falling prey to the status quo, falling prey to the old stale talking points. Well, we can't do this, we can't do that, pointing fingers. And if there's any overreaching message I want to communicate today, it's time to do your job. It's time to get things done. You asked for these reforms, we've provided them, now it's time to deliver. And one of the technical things we're hearing as a complaint at the local level related to the conservatorship reform, Senator Eggman and her colleagues will clarify. I don't think it needs to be clarified, but I'm calling the bluff. As it relates to SUD, substance abuse disorder, and certain types of beds, the county is saying, well, we just don't have legal clarification. We're now going to give them to them. There's no excuse. I mean, there's no ambition. If counties, when I say no ambition, some counties are moving forward aggressively. I'm going to brag on Mike in a second and the supervisors. But some counties are saying, well, we can't even set this up. They can't even have the ambition of helping one person. They say, we just don't have the resources. You can't find one person under the conservatorship reform now? It's because they're unwilling to do the work that's necessary. The state's vision is realized at the local level. We can't do that job. They need to do their job. So the conservatorship reform was foundational in terms of clearing the decks in terms of one of the principal complaints. You heard the second, and I want to compliment Mike. This will be one of 4 or 5 compliments. He didn't have to. Supervisors, you didn't have to. I want to thank you for supporting moving forward early on Care Court. That's a new paradigm, not substituted care, but supported care. That's a new paradigm as it relates to court plans and oversight and due process. It's a new pathway that's provided help for hundreds and hundreds already, with a goal of 2,000 by the end of the year in this pilot phase, that because of your commitment to enter into the pilot phase, as now 8 counties have, it will accelerate our efforts as we move forward for the full implementation that which occurs in December of this year. So I want to compliment San Mateo for being willing to do that. And that's the spirit. That's what we're asking for. Meet our resolve. Let's go. We've got those resources. But the issue you heard it over and over and over, and it's absolutely spot on. Housing. Lee was absolutely right. Housing as a foundational component part. 6.38 billion reasons we can say we, the people of the state of California, met that call. $6.4 billion of new funding to provide housing. And why are we here? To illustrate exactly the kind of housing that's eligible under this new funding source the people of the state of California just approved a couple of months ago. Scattered site housing, cottage setting housing, campus style housing, building on a successful model, what we refer to as the B-chip model. You can ask me more about that later. So we don't have to reinvent the wheel. We just keep going with zoning and siting reforms so that we don't turn into the ongoing dialectic, as is example down here between Millbrae and San Mateo County. You want to ask me about Millbrae? I'm happy to add more salt on that conversation. Need to get things done. Everybody needs to row in the same direction. But here's the difference. The last time we did anything like this, No Place Like Home, there was a bond around behavioral health. You know, it took, and this is important, it took 2 years after it was approved to put out the notice for funding availability, and then months and months and months to approve the plans, and then months more before those dollars were actually sent out. That is not the case today. Today, we're announcing, unprecedented, a 2-year process. We are collapsing this just approved bond. The first $3.3 billion will be going out in July. In a matter of weeks, $3.3 billion on the notice of funding availability will go out. We will quickly approve those plans because we have a new task force and strike team around this, breaking down all of the boxes and bureaucratic hurdles, time to decision making, and they will approve those notices of funding on the basis of merit and scores and move those dollars out on the first $3.3 billion in a matter of months, not a matter of years. And so again, we're asking the counties to match that ambition. On conservatorship reform, match Mike and the supervisor's ambition. On care court, you don't have to wait till December. Let's go and let's move forward. Get ready, get those applications going, and let's move these projects forward. And I think it's interesting. And again, I said there's a general thematic here. There are a number of counties. Mike and San Mateo is not one of them. There are a number of counties that are saying, well, we just need more money and more housing before we can move with these reforms or to do anything. These are the same counties, there's 19 of them as I speak, that are out of compliance on their housing element, that refuse to even zone and plan for more housing. You can't make this up, it's almost Orwellian. 19 counties today are out of compliance. You know, one of the poster childs down there in Huntington Beach. That's why I'm a little more aggressive as it relates to Millbrae. You're either part of the problem or you're not, period. Period. Solution, that is. Let's move out of the way. Let's do the right thing. And let's have the sense of urgency the people of the state of California demand. 2 other things we're doing today. We have a new website, I know. But mentalhealth.ca.gov, mentalhealth.ca.gov is up and will provide information. It's in version 1.0, as we refer to it. So it's going to be a lot more bells and whistles. The first version is basically an overlay of what is now being made available the resources that are out there from 911, CalHope, all the other programs, the mobile crisis programs, all the other things the senators have advanced and supported that are part of this matrix in strategy. That information will be one site available to folks. And then there's a second, the version that we'll be putting out very shortly is a compare and contrast map for different counties. I want to know where the counties are. You want to know where your county is. Where are they along the process to actually deliver on these results? And so this is about the transparency that was also part and the accountability of Proposition 1. We heard you. The public wants accountability, not interested in how much money we're spending. I'm not either. I want to know what we're resolving to get done. I want to see it. I want to feel it. And so what that is reflected not only in the reforms under Proposition 1, but this website that we're putting up to allow people to track for themselves in real time. New auditing functions, new oversight as it relates to the state, over the counties, working in partnership as it relates to these reforms. That is also part of the Mental Health Services Act reform that Senator Eggman was referring to that makes eligible now housing for the first time ever, $1 billion a year of ongoing housing dollars for people that are self-medicating, in many cases, with drug or alcohol addictions, with bipolar disorder, schizophrenia, paranoia, severe depression. Those dollars will be transitioned over the next year and a half, July of 2026. When that fully transitions, we want to be providing technical support for the cities and counties to provide for that transition as well. So forgive the long-windedness, but this is nuanced, it's complicated, but it's also very enlivening. And I'm very excited about the journey we're about to go on together as we change the paradigm and focus and we begin anew our partnerships with the cities and counties. I said I was going to brag on Mike 4 times. I think it's only been 3. Let me just close on this. You want to know who's doing it best? It's your executive, your chief executive here at San Mateo County. There's been no greater partner at the county level than Mike, providing constructive criticism, providing unique insight, demanding always more, but demanding all of us do better, and always being willing to meet the moment in terms of his own accountability. And for you, both you members of the board, thank you for having his back, and thank you for having our back at the state level as we come back here at the local level to advance these efforts. So that's the announcement today. Few months, not many years, new accountability, a new energy. Let's move on conservatorship reform. Let's move faster on care court. And let's row in the direction the people of the state of California demand. And let's also do more to celebrate our vets, $1 billion. And I will say, if there's any good news, and I'll close on this officially, state of California has seen a decline in veterans homelessness. We have a national model. What Proposition 1 did is it reinforced that model, provided more resources to advance that model, and we're very excited to get those dollars to work as well. So with that, we're here to answer any questions.
From KTVU, thanks for taking the time. You just announced you may revise cuts and delays to affordable housing, homelessness programs. Do you hope that Prop 1 bridges those gaps? And on the topic of counties, what do you tell those folks that say they can't reach their goals with those cuts?
They've never been more resourced in the history of the state, period, full stop. Never been more resourced in the history of this state. Never had more tools, more flexibility in the history of this state. We kept the funding, fundamental funding for all our existing homeless services. There are a few changes more broadly across the spectrum, more than backfilled as it relates to the $6.38 billion with all that direct money, ongoing money on the way with the reforms under the Mental Health Services Act. Let's go. I'm not buying those old arguments anymore. Let's go. They have the direction. They know our commitment and resolve. They have unprecedented resources, and that's what we're announcing today, a speed and a scale to our approach that I also know they were hoping to hear, and I hope that will aid and abet the local efforts to do the same.
Hi, Governor, thanks for the time. Chris Ancarlo with KCBS, and just wanted to ask, we heard about care fatigue and some of these other phrases. Given that Prop 1 passed maybe a little bit more narrowly than expected, is there another level of pressure here to show the results at the risk of losing public opinion on future state and local ballot measures designed to attack homelessness?
No, I appreciate the question. I do, and I appreciate Senator Becker's point. I don't look at it from a political paradigm. That's a situational political frame, public this, that. It's a moral imperative to address this issue head on. What Mike was saying, and I appreciate it as well, as a subtext, and now I'm piling it on a little bit and complimenting him, was if you don't think what he's doing is working, spend time with him. See the programs he's stood up. See what Home Key has done. I mean, Home Key alone, 250 projects, 15,319 units, 15,319 units. Tens of thousands of people that have cycled out of that to permanent and to other housing and other permanent supports. Tens of thousands more taking advantage of that framework. So I just think right now all that matters is producing results that people of the state deserve and the people that are struggling expect and deserve as well. We'll let the results should speak for themselves, and the public will always have our back as long as we're doing our job. And that requires all of us, again, to step up those efforts. And that's one of the, again, critical calls today is we can't do this alone. The state needs local government. And we are demanding with a sense of urgency that we move with deep partnership to meet the needs of those that are struggling and to meet the expectations of the people we serve.
If I may, a second question off topic. You're going to the Vatican. What's the message you're taking to the Pope when it comes to California's approach to climate change, and how do you win over Catholics around the world?
Well, that's a deeper question, winning over Catholics around the world. But you get a call, or at least an invitation from the Pope. You know, it's wise to accept it. And I was honored to be able to accept an invitation to go to the Vatican overnight. And I've got a couple days there at the Vatican to talk about an existential issue that impacts all of us in more ways on more days, and that's the issue of climate. Issues that are very familiar to the people of the state of California. No state has more to lose, not just more to gain in terms of addressing climate change. And few states, sort of few subnational jurisdictions in the world have more to share in terms of tools and best practices. And so I've been asked to discuss California's nation-leading initiatives to mark our progress and to promote our ambition at a next level. And so I'm really humbled to be able to do that. Thank you.
Governor, thanks for the time. I also want to say thank you to Lee for sharing your story.
Yeah.
I went to your son's high school, although I don't know that I knew him, but anyway.
By the way, for the record, if you don't know Lowell, it's the Harvard of high schools. My mother went there as well, but so we're proud. Then she went to Chico State, but that's another conversation.
Oh, very different ends of the
It
spectrum.
was a little different, but she was proud to be at Chico.
I hear you talking about merit, Governor, and I hear you talking about accountability. I'm wondering if you would be willing to say here today that for the cities and counties that don't report their outcomes, would you cut or freeze funding?
I mean, look, we've made that crystal clear. You may recall 2 years ago, the first required homeless plans were submitted to the state of California. I rejected all of them, which means we held the money. So the answer is unequivocal. Yes, it's about accountability. It's about oversight. It's about, at the end of the day, we want to, it's a stubborn phrase, pay for performance, but we want to fund success. We want success to be emulated. I'm not interested in failing more efficiently or funding failure. So at least I speak for myself. I'm just one branch of government, but we want to invest in excellence.
I can also ask a follow-up. I watched, as you may have also, the subcommittee on oversight where your homeless agency was asked about the audit, and a number of lawmakers there on both sides of the aisle said that it sounded like excuses from this agency. How do you describe that? What did you see?
Well, none of it surprised me at all. In fact, it's the reason we're very proud. Member Ward just introduced legislation. We requested of him last week to incorporate homelessness into our housing accountability unit, which has already unlocked 23,000 housing units. Ask the folks in Half Moon Bay about that housing accountability unit. We're not shy about exercising our opinion and ultimately holding local government account to state law. And that's the spirit we want to bring into homelessness. And I know that's a spirit the legislature also wants to bring in accountability. So we're looking forward to that, getting back to my desk and moving in that direction.
Hi, Governor. Thanks for answering some of our questions. I'm Annabelle Sosa with the LA Times. Someone already asked my question about the Vatican, so I'm going to go ahead and ask you a question I didn't get to on Friday during the May revision.
98 minutes, and we didn't get to it. All right.
So you talked about certain rollbacks to criminal justice reforms and being mindful of the unknown when you talked about potential prison closures. I really just want you to be able to say on the record what reforms you were referencing, and if it was the Prop 47 ballot initiative or any others that you're concerned about.
Well, that was one of them, and
What are
others
the
are being
others?
discussed, but that's more speculative. Prop 47 is not speculative. I mean, they've got signatures, and it's respectfully not a reform of Prop 47. There's other component parts that I would say are more broad in terms of the reform, but that's one of many specific. That's a specific. There are other ideas that are out there being promoted.
But is that initiative really, if voters were to pass it in November, is that something you're really concerned in terms of
I just think it
rising
rolls back.
populations in prisons?
Well, I don't think it advantages that. I mean, obviously, if you read it, you'll see the component part that brings people back to the state. So by definition, will impact that. But it's specific example, and then there are other ideas that are being promoted out there that I think would roll back progress.
Do you think that it would dramatically increase the populations?
Well, I think you start stacking all these things together. But again, it's not the only idea that's being promoted out there.
Are there other ideas you're willing to?
There are other ideas that are out there, and we'll leave it at that. Look, I don't want to get
Okay.
we can litigate this. All I'm saying is, and I think this is the deeper point, our prison population is not static, period, full stop. And we have to be mindful of that, and we have to have a flexible mindset that there are things being promoted specifically. There are legislative proposals that are quite literally being considered by their colleagues. And there are other interest groups out there that are looking to potentially promote additional ballot measures. We're making decisions not just situationally. When you shut down a prison, you're making a long-term decision. So you have to have a more sustainable mindset, and that was fundamentally what I was trying to communicate. But in answer to your question, yes is the answer to the Prop 47 reform that I do think would move us in a very different direction than we've been moving. And I think that's the intention of its proponents. But my intention is to work with the legislature to pass reforms today that provide flexibility and actually address the real problems that many of those proponents are stating.
I appreciate your answer. Just second question, second and last question. What is your administration doing about the recent allegations out of two women's prisons in Chowchilla and Chino with the latest sexual abuse allegations coming out of those facilities?
Let me have CDCR get back to you in terms of the details about those.
Any remark or comment in terms
Well,
of?
anytime there's allegations, we take them seriously. They're investigated. Any sexual assault allegations, we pay particular attention to and express obvious condemnation and concern about any activity along those lines. So it's appropriate when in an investigation that we let those facts take shape and share that information as soon as it's available.
Thank you.
Thank you.
Governor, hi. Thanks. Rachel Bluth from Politico here. As you mentioned, this big new building is not built with Prop 1 funds. It's built with B-CHIP. So in your May revision, you're actually cutting B-CHIP and a number of other programs, CYBHI, Continuum Care, that are meant to kind of prop up and support Prop 1 until we get there. So do you think that those cuts are at all hampering other counties' abilities to do what you're kind
No,
of telling
I don't, candidly, respectfully. $3.75 billion in new money under Home Key, $2.2 billion under that program that didn't exist before I got here. I mean, these are unprecedented investments. So any short-term issues, I think if they're used as an excuse, we should expect no progress. People know what's coming, and that's $1 billion a year. $1 billion a year for new housing support under the Mental Health Service Act that was not otherwise available. They know that money's coming, and they know when that money's coming, and they have the ability to plan for that. And so, no, I don't think that should in any way impact the progress and the promotion of that progress.
All right, I also did not get a question in on Friday, so I've got to ask you, what do you say to critics who say that you are going back on your planned promises to Medi-Cal with the MCO tax and investing that money back into Medi-Cal? I'd actually love to get our legislative leaders to weigh in on that too, if they want to.
They have our proposal. It's hard for me to square that with my advocacy to get the MCO done in the first place and all the hard work going back and forth to Washington, D.C. and working to get the waivers. So, the characterization of that frame is difficult for me. And as it relates to the work I've did in the past on the MCO and the work that we provided unprecedented supports, Dr. Galley, if I may ask him to come up as well on behalf of the administration, who's done a lot of that work, most of that work. There's no administration that we know of in the United States done more in the CalAIM frame, the work to address the provider payments. We've been working hard over the course of the last number of years to bolster that up, and we're doing everything we can to get this new iteration done, but being done in a sustainable way. So, with that, maybe Dr. Galley could talk more about what I consider is heroic work, getting this MCO deal done in the first place, to be able to be in a position to make these unprecedented investments back into our healthcare system, which we will be doing.
Yeah, Governor, right on. We remind you that before the last MCO, mostly those dollars didn't go in as a focused Medi-Cal investment. In last year's budget, we took 3 very critical service lines up in their rate, up in their augmentation and their reimbursement rate to create some security there. The efforts to do more in a tough year, I think, were forced in some ways to delay some of those, but certainly those investments that we've made in CalAIM that are coming in BH Connect as we get that approval this year, other approaches with the federal government to enhance our overall reimbursement of Medi-Cal services across the board, I think are important investments to not overlook. We work closely with all of our partners in the healthcare delivery space to really take a temperature and see where we have to go next. I think there's a lot of conversations to have in the next weeks, months, that this moment, if you will, where we are in right now, looking at all that we've done and looking at opportunities in the future. I think this is a state that, despite some real challenges in a budget this year, looks to partner with our federal government in different ways, in new ways, to increase those dollars that we might have, then make it available. I think the really important work that we've had to expand not just benefits, but eligibility to those benefits is absolutely critical. And obviously the work on rates and access continues and is something that we're working hard with our partners. But I think the governor is absolutely right. There isn't an administration that without some other push, made these kinds of investments to, frankly, transform the Medicaid system in ways that I think will benefit Californians, not just for the next 12 months, but for decades to come, and our look not just at what happens within the 4 walls of the clinic, but well beyond, as you see here behind me.
Doesn't even include, but beyond that, we're moving forward, first in the nation, universal health care, which is an extraordinary achievement, particularly under the current budgetary constraints.
Thanks. And just lastly, we're here in San Mateo County, which also is not planning to implement SB 43 until 2026.
Until this press conference. And Mike's going to enthusiastically work with the supervisors. I'm putting no pressure on staff right now.
I'm seeing a head shaking back there. Is that because your county sent out a press release this May 2nd that it was doing in 2026. So are you bumping that up?
Yeah, we really are putting Mike on a spot. And you don't have to say yes, Mike.
No, it's a great tool, and we're going to try to implement it as soon as possible. And I've had the discussions with our staff. I can tell you right now, we're actively looking for places to house people. But yeah, we're going to implement it as soon as possible.
Thanks so much.
All right, thanks. That was a good question. I appreciate it.
Hi, Governor. Hi, Governor. Good afternoon. Thanks for being here. Vic Jolly with the Sacramento Bee. You trimmed during the budget revision the Homeless Housing Assistance and Prevention Program money, and if you have addressed that a bit, Proposition 1 goes to a specific subset to aim to help and potentially will help a specific subset of the population. Can you talk about how you expect to continue, or do you expect to continue to add money to
The HAP program?
yes, and also to Home Key?
Well, in an ideal world, would love to. I mean, we helped create those programs. Home Key, quite literally, and HAP came from a version of that program that Governor Brown worked with the legislature to advance. So we have, done our best over the last few years to enhance those investments situationally. Budget we submitted did not provide additional resources. The legislature, in their wisdom, will make that determination on the basis of what they believe should be prioritized in this budget over the course of the next number of weeks. And they can make a determination if they want to continue to appropriate levels that we've seen in the past, and we will dialogue with them with an open mind about our ongoing fiscal burdens, not just our short term. As it relates to eligibility, I'll remind you under Proposition 1, there's pretty good flexibility as it relates to prevention dollars, rental dollars, as it relates to that $1 billion. So that population, that subset, also, as you know now, includes, because of Prop 1, clarity as it relates to people that are using substances and housing and all of those, in some cases triply diagnosed, not dually diagnosed. So there's tremendous flexibility in that space as well.
All right, finally, sir, when can the public expect the first housing, either rehabbed or new, under Prop 1 to come online?
Well, look, we're providing all the resources to give them the ability to do that in a very short period of time. Again, just a matter of months, we're getting the first notices of funding. I'll remind you that we will be approving these applications by early fall, and those dollars will be out the door around the new year. And we want to see things happening. And again, we're not just looking for these 6, 7, 8, 10-year projects. Quite the contrary. We're looking to fund projects that can move, quick rehab, acquire, looking to convert along the lines of what we did under Home Key. The time to deliver on Home Key, again, 15,319 units. By the way, you could fact check that. It's an actual number because I get an update every week on that. That's real. In just a few years, we were able to accomplish that. And so that's the spirit we want to bring into the Prop 1. It's the ability to acquire something, to get it operational and online. And under Home Key, I think we've averaged 90 days after acquisition to actually get people in the housing units. So that's kind of a model for us. But again, every component of this will operate or will be distinguished on the basis of regional issues and needs. And so we're just hoping to move as quickly as we possibly and humanly can.
Thank you, Governor.
Hi, Governor. Ethan Varian with the Bay Area News Group. Not to beat a dead horse, but on this revision, I'm just going to follow up real quick on a couple questions that have been asked. Was part of the thinking in this revision that some of the cuts and not putting HAP in the proposal, that Prop 1 is here to sort of fill those gaps that may be created, or is that not it?
No, that's not the way I looked at it. Look, I said it. We have a math problem. And we've got to fix it. I mean, that's the thinking behind the budget. And I want to fix it. We'll work with the legislative leaders. And it will be a process that unfolds over the course of the next few weeks. We don't want to just fix it this year. We want to fix it next year as well. We want to address the ongoing issues. So it's a question of priority and balance, totality, the unprecedented investments in this space that go well beyond HAP. I might just give you the encampment resolution grant. That was $750 million alone. And you saw the money we just put out on that a few weeks ago. And so there's so many component parts. But no, it was just looking at the totality of the investments we've made, totality of the shortfall, and making an assessment. And that ultimately made the determination.
Okay. And I'll bite. Tell me about Millbrae. And is there any broader concern, I guess?
No.
Because it's a court
Tell me
case.
about Millbrae.
It's Article 34, right? Is there some concern that if the courts rule a certain way that it could put Home Key in jeopardy?
Well, look, the issue of siting is incredibly important, and the community is incredibly important. No one's naive about that, but all of us have to have to do their job and row in the same direction. And so it's just unfortunate. I'm mindful of Title 34. I'm mindful of those legal arguments that they'll be making. I just don't buy them. You know, as I said, you know, we want partners, not sparring partners. And we're not looking to call them out. It's just they've called us out on this. And I think they're calling out the public. What's the number one issue in the state of California? Yes, a vast majority of people, they're going to say it's homelessness and housing. And they have an opportunity to save people's lives. They have an opportunity today to address the housing needs of the homeless and address the anxiety of their community around people that are on the streets and sidewalks, make the community feel safer, more like a community. They have a chance to do that with state resources that are unprecedented. And they're saying no. I mean, you can, if I'm not coming across a little frustrated, I think I'm just frankly expressing how the public feels. I just don't think they're a poster child of best practice what to do. I think they're an outlier of what not to do. And I say an outlier because they are the exception. I mean, we have some of the reddest counties in California enthusiastically embracing the home key model. It's been extraordinary. And I'm proud of rural California. I mean, it's amazing how overwhelmingly embraced this is. That's why it's particularly disappointing here in one of the great counties, in one of the greatest states and the greatest nation God has ever conceived.
Great. Thanks, Governor.
Governor, I've been told I'm the last question, and it's off topic ahead of Memorial Day. Any update you can give us to Highway 1, Big Sur?
Oh, I have two additional announcements. One of them is Highway 1 and Big Sur. So you get the lifeline. Thank you for that. Before I say that, can I just say one other thing? There's been an unbelievable amount of attention that has been placed on the Archwell Foundation. I'm here at a behavioral health site, a mental health site. Archwell Foundation, run by Meghan Markle and Prince Harry, do extraordinary work, particularly women and girls, but notably around mental health. And I just want folks to know, not only are they in compliance, it was a technical paperwork issue that was wildly hyped. And with respect, I hope people that ran those headlines run this headline, that it was a very typical technical issue around paperwork that persists for so many others as well. And they're in full compliance. And they're a celebrated organization that does great work in the state of California. So I wanted to clarify that because that's important. And I just thought there was a little bit of a piling on that was deeply unfair to that charity. Number two, we're trying to address, we have been for some time, the deep anxiety of folks out there on Highway 1 and try to get that highway reopened. And good news is this Friday at 6:30 a.m., Highway 1 will be reopened. Caltrans working overtime, subject to act of God, extreme winds, unlikely rain, but extreme winds, we'll be able to achieve that. 6:30 this Friday, Highway 1 will be reopened. So I appreciate the opportunity to share that news as well. We appreciated the opportunity to share all these news. I hope folks behind me were wearing sunblock. Thank you for your patience. And again, the team assembled behind me are doers, and this is our strike team. And the two legislative leaders and two supervisors here are people that get things, but also get things done. And I'm grateful to them and their leadership. Thank you all very, very much.